डॉक्टर अंजम साहब से गुजारिश करूँगा कि वो जो उन्होंने थैलेसीमिया को ट्रांसफॉर्म किया और उसकी एक मिसाल, ये बेटा जो बैठा हुआ है बांग्लादेश से, इसको क्योर हुई इसकी, तो वी आर फीलिंग वेरी प्राउड मूवमेंट। और हाई कमिश्नर साहब के ख़िताब से पहले आप तशरीफ़ लाएँ।
Bismillahirrahmanirrahim. His Excellency Hasib Bhai and my respected colleagues, Muazzez Samin, और मेरे स्पेशल गेस्ट, मेरे हीरोज़, माई होप, राजिक एंड अयान, अस्सलाम वालेकुम। अल्लाहुम्मा सल्ली अला मुहम्मद व अला आलि मुहम्मद कमा सल्लैता अला इब्राहीम व अला आलि इब्राहीम इन्नका हमीदुम मजीद। वैज़ा मरिदतु फहुवा यशफीन. When I am sick and unwell, Allah cures me. Prophet of Allah said, indeed, Allah has created a remedy for every disease. Seek cure. And as a medical professional, as a doctor, I am convinced and I believe that there is cure for every disease, but we don't get benefit out of it. And all of you know, we are spending around $250 billion globally for health research, which is nothing, while we are spending over $1 trillion for vast destructions and devastation. As a human, in our body, there are 21,000 genes. Many genes have not been studied. Only 6,000 diseases has been identified. And unfortunately, out of this 6,000 disease, the cure is available only for 20 to 30 disease. सिर्फ 20 से 30 बीमारियों के लिए इलाज मौजूद है. Let's ask one question to ourselves. We have to reflect the blessings, the bounties we are getting from the Creator, the God, the Allah Almighty. What we are doing for that? What's the responsibility we have, and we are fulfilling that responsibility? I'll give one example. What's the most important essential thing in our life to survive is oxygen. And आपको पता हम कितनी ऑक्सीजन खर्च करते हैं? We consume 500 liters oxygen every day, and it costs 25 pounds per day. And for oxygen to take from lungs to your tissue, you need a blood. And all of you know, the thalassemia patient, they need transfusion every 3 to 4 weekly, and it costs 600 pounds. And I calculated, just for this blessing, just for this oxygenation, we are spending, if we are discouraged or disadvantaged, we have to spend 1,300 pounds per month. Think about it. We have to reflect ourselves. We have some responsibilities. Those who are disadvantaged, those who are deprived, what we are doing for that. And thalassemia disease is one of this. I always say, before I go to thalassemia, let's see some incidents, prevalence in Pakistan. In Pakistan, we have 10 million thalassemia carriers. 10 million. And we have 100,000 thalassemia patients who are in blood transfusion, registered. Those who are not, so we don't know. And every year, 5,000 to 9,000 babies are born with thalassemia disease. What we are doing for that? We are not doing anything for that. And do you know, in Pakistan, the median survival age of these thalassemia patients is 3.5 to 5 years of age. In UK, 35 to 50 years of age. Why this discrepancy? Why? Because thalassemia is underreported, underfunded, not prioritized, not in headlines. But the this thalassemia is taking the children's lives away very silently. That's why my colleagues, our friends, who are sitting in the stage, we established a Global Thalassemia Foundation. And Global Thalassemia Foundation has only one agenda, one goal, to eradicate thalassemia not from Pakistan, not from Bangladesh and India, from planet. That's what we are aiming for. And all of you know, when I was in medical college, Umar Sharif used to say, the diseases are classified based on poverty. गरीबों की बीमारियां, अमीरों की बीमारियां, डायरिया, वोमिटिंग, टीबी, मलेरिया, बीमारियों की बीमारियां, गरीबों की बीमारियां हैं. ब्लड प्रेशर, हार्ट अटैक, शुगर, अमीरों की बीमारियां हैं. That's wrong now. अभी मैं कहता हूं कि जो ब्लड प्रेशर है, शुगर है, कार्डिक जो बीमारियां हैं, वो गरीबों की बीमारियां हैं, जो अमीरों की बीमारियां हैं वो मेंटल इलनेसेस, एंग्जाइटी डिसऑर्डर्स and obsession disorders and genetic disease. The future is genetic disease. Every disease is linked with genetic. That's why we want to work on thalassemia. We want to make thalassemia will be a question of past. Okay. For that we have model. And first of all, before I will talk about the model, I just want to share you screening and genetic counseling. What is screening? Screening ये होती है कि you do screening before marriage. You know how much it cost? 3,000 Pakistani rupees. And after marriage, 60,000 Pakistani rupees. Once baby is delivered, it costs 40 lakhs, 40 lakh रुपए लगते हैं. Why we are not doing? In Pakistan, we are spending 10 to 20 Arab rupees on blood transfusion. We are not spending any money on screening. So we have the model. Our model is very simple and straightforward. And you will be convinced. I'll just explain you. The first is what we do, we identify the patient, the high-risk population, and we define the area, we circle the area. And what we do blood sampling. We spend 3,000 rupees per patient. We do genetic counseling, and if needed, we will do IVF, we sponsor the IVF, and we will clean that area. Our model, we have started 4 models in Pakistan. One in Karachi, we have defined the area Liari, we have the patient list, we have started already, and Mariam Asim is leading for that. We have one in Rahim Yar Khan, Dr. Qazi is leading for that, in Lahore is Dr. Aslan, and Islamabad is Janal Najum. तो हमारा ये जो मॉडल है इसका ये है कि लेट्स से कराची जो ही हम लियारी को क्लीन करेंगे तो हम वहाँ के डीसी को बताएंगे कि दिस इज़ ग्रीन डिस्ट्रिक्ट, सो दिस इज़ थैलेसीमिया फ्री डिस्ट्रिक्ट. In future, we are not expecting any patient from this area. But this one condition is a medical de novo, sometimes this mutation. For that, we will do the gene therapy. Our model is very straightforward. So this model is contagious positively, is replicable. So our colleagues in Karachi, this 92 organization in Pakistan, when they will see the Liari is green district, they will work on the Orangi. Same in Islamabad, D12 we have defined the area. Once D12 is clear, we got E11. So this is how we want to make whole Pakistan green and thalassemia free Pakistan. I'm not just making dreams or just making statements. Iran has done, Cyprus has done. You know, thalassemia was started from Cyprus. Cyprus में start हुआ था, and there's no more patient. And Iran in 1995, in Iran one district there's 500 patient, and in 2011 there's only 2 patients. Iran has eliminated. Why we can't do? We can eliminate this from Pakistan. So I have good news for you that in 5 to 10 years we'll reduce this thalassemia incidence in Pakistan by 90%. Inshallah. The last thing, Hasiba, just 2 minutes more. Okay. The last thing is the gene therapy. You see, the gene therapy, usually I say the pre-gene therapy and post-gene therapy with thalassemia. Pre-gene therapy thalassemia was a clinical challenge. You saw the video, all the complications. And the thalassemia is not a clinical challenge. It's a moral duty, it's a moral obligation. It's our social responsibility. You know why? Because it's medically feasible, treatable, is economically, it's viable, and it's humanly, for all of us, is essential. And if you want to see the model, I will ask my hero, Razik, and Ayan, come here. Come here. So this is thalassemia, post gene therapy thalassemia. Come here, my heroes, my boys. Come here, both of you. Okay. Tell me, Razik, how do you feel before gene therapy and after gene therapy?
Before gene therapy, I felt de-energized and very tired. But after gene therapy, thanks to you and everyone else who supported me, I felt more energized and I felt much better.
Okay. You want to say something? No? Okay.
I think his smile has said everything.
Okay. You want to go and sit? So this gene therapy is I think, if you remember, 10 years ago, the HIV medications were a nightmare. It's very expensive. Same with the gene therapy. Gene therapy is a very simple procedure. I just thank to Great Amsterdam Hospital. They gave me only contact. I have seen with my eyes. It's just a blood exchange transfusion. That you did recently. So you just take the blood and reinfuse the blood back to the child. But you need a specialized technique, specialized equipment, specialized transport, and specialized machine. Or inshallah, I did this gene therapy. They pay me around 1.6 million pound per patient. And 2 weeks ago, the Vertex Pharmaceutical rep came, and I can see my consultant colleague here. They brought a big lunch, Asian lunch. Everyone ate, enjoyed, and by the Serum Institute of India, they want to offer gene therapy in Pakistan 20 lakhs. But yesterday I spoke to my friend Secretary Health Punjab, Azmat Mahmood Saab. And he said it's very difficult to get it from India, but try to get it some from China. And I'm hoping we'll get cheaper than China. And believe me, write it down, that all the children's thalassemia gene therapy will be done in clinics. It's so simple procedure. It's so simple. In next 2 to 5 years, the gene therapy will be conducted in the clinics. You don't need anything. Just you need simple room. Inshallah, we will do that. The only thing I want to say at the end is gene therapy makes life better. You can see, improve the growth, the development, the education and career. But one question I'm asking to all of you, at this moment, बलूचिस्तान में एक टीनेजर आपका वेट कर रहा है कि आप वहाँ जाकर उसकी स्क्रीनिंग करें और उसके फ्यूचर को महफूज करें। सिंध के गांव में एक औरत एक माँ दुआएं कर रही है कि आप लोग जाएं और उनकी हेल्प करें, उनके बच्चों के लिए जीन थेरेपी का बंदोबस्त करें। और गिलगित बल्तिस्तान K2 के बेस पे एक फादर आपसे इल्तिजा कर रहा है कि आओ मेरी हेल्प करो और मेरी जो फाइनेंशियल है प्रॉब्लम्स हैं, मेरे जो साइकोलॉजिकल प्रॉब्लम्स हैं, इनको आप हेल्प करें। तो अगर हम सब मिलकर काम करेंगे तो थैलेसीमिया इंशाल्लाह इन 5 to 10 years हम इसको पाकिस्तान फ्री थैलेसीमिया होगा और हम जीन थेरेपी क्लिनिक्स में करेंगे। इन क्लिनिक्स वी विल कंडक्ट इन द क्लिनिक्स। थैंक यू वेरी मच।